Commissioner Tammy Bremer,
Present.
Commissioner Lojinos Gonzalez, Councilmember Dave Donaldson,
Present.
Dr. Richard Vu,
I'm here.
General Jack Briggs.
Here.
And I understand that Mayor Glant Havignard is watching online. Glant? Hopefully she can hear us if we can't hear her. And then we've got a new member to our Board of Health that I would like to welcome. I won't spend a lot of time seeing Dr. Deborah Chan, but I will let her an introduction. I would like to mention that we had an opportunity, and Deborah has a MPH, and really reading her bio, work has taken you all around the globe, and sounds like very interesting work. But Dr. Deborah Chan is with us. Doctor, would you like to introduce yourself to the rest of the board?
Deborah Chan. It's good to meet all of you. I hope that I'll have the opportunity to get to know one of you a little bit better, and I hope that you'll bear with me in this beginning. I feel like I'm trying to get up to speed on the workings of the community, and I'm probably going to be asking some questions that are going to be self-evident to everybody else. But I hope that you'll bear with me, and I look forward to serving with you.
Okay, hopefully you've all had an opportunity to look at the agenda and had an opportunity. I need a motion and a second to approve the agenda.
I move to approve September 7th.
Second. Briggs.
Okay. We have Doris making the motion and Jack Briggs making the second. Any comment about the agenda? Okay, all in favor of approving the agenda as written, let it be known by saying aye.
Aye.
Any opposed? Okay. Board of Health comments. We'll kind of go around the room and see if anyone has any comments that they would like to make. Start with you, General Briggs. Way around. Councilman Donaldson.
Thank you, Mr. President. And I would just like to say that a couple weeks ago I missed the public health barbecue. I had PPACG in the morning and something else in the afternoon and something at lunchtime. But I would just like to say I wish I could have been here to say thank you to all those who are doing the work of public health, and I truly appreciate it. And again, wish I could have been there to say that personally. So thank you.
Thank you. Dr. Vu.
No comment.
Comment.
Dr. Chan.
No comments.
Okay. Well, I will jump on with what Mr. Donaldson said. I was able to attend the barbecue, and for the rest of you, you just missed out on some. It was good food, good fellowship with the team, and thank you for the work that you do. I'll second what Councilman Donaldson said. Now we're going to go on to the approval of the minutes from our August meeting. Again, I'll need a motion to approve in a second.
Move to approve the minutes, Councilman Donaldson.
Second, Doris Ralston.
Okay, thank you. Any conversation about the? Well, let's vote.
I was not present, so I will abstain from the vote.
Okay. All right. All in favor of approving the minutes as written, let it be known by saying aye.
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 Any opposed? None. And Commissioner Bremer is abstaining. Okay, public comment. I know that we do have someone present to make public comment, and I've got some handouts that were presented to me. I'll send these around. Everyone. And as well as the handout, we've got some pamphlets here that are Declaration of Independence, Constitution of the United States, and Bill of Rights. And these are for any of you that wish to have one. They'll be sitting right up here. And so who is our here for public comment? All right, if you'd make your way to the podium and introduce yourself, and are you a resident of El Paso County?
not our friends, if we're protecting our health. Recently, COVID shots for babies just approved. Study on 20 mice. Unbelievable. So we're asking you, my last question is, well, one thing, I will leave this with you. Colorado PhD economists studied the effect on the economy and health. 40% of small businesses in Colorado went under. That's people's life savings. That's a crime. So my last trivia question is, when people say, give unto Caesar who is Caesar's, that's why I left these Constitution handouts. You can have fun with those. Put them on your desk and ask people who they think is Caesar. Most people think it's the federal government. Not true. You might think that you report to the county commissioners who appointed you to this board. That's not true. In our country, we the people establish a government to protect our liberties. So we are Caesar, looking at a room full of Caesar. So we ask you to work with us and pass this resolution to run the next pandemic, God forbid there is one, locally, and work with us to protect all of our health and freedom. Thank you.
Thank you.
Questions, comments? I'll leave this for the record.
Set them on the corner of the desk. Sorry about that.
I've got, thank you. I appreciate the information. I've got two questions. So you did list first Wolf.
Yes,
Are they known experts or
they're,
something?
they're censored experts. I follow censored experts.
Shortly, I just want to know.
Yeah,
Known.
they're very well known among the censored experts. Naomi Wolf ran the project to analyze the Pfizer papers. She's a doctor and she's somebody who commits real journalism.
And then my second question. So you're asking about reference to Pennsylvania. So not listening to the states. Somebody would argue, I think, that, well, what happened was the states provided the mandate. So the resolution saying that we can only do what's reserved to the states, somebody could argue that what was done by Governor Polis and state, not the federal government. So how would you respond to that?
Well, good point, except Dr. Birx in the White House has written a book bragging about getting President Trump to do the first lockdown, and she knew she could only get, I think it was 15 days, but she knew she was going to go for more. So that originated in the White House, and the PR campaign, y'all go get the shots, even though they were poorly developed, was done by the military. It was a PSYOPs campaign. So you're right, Polis, the states jumped in and followed that lead. Any other questions?
All right. Thank you very much.
Thank you.
Okay, and now we're ready for our finance and budget presentation. I'm sorry? Oh, we have one more comment? Yeah, please come forward. Give us your name and are you a resident of El Paso County?
Yes, I'm Russ Cotton, and I am a constituent in El Paso County. I am here to endorse Donna Rook's presentation as well, and with the intent to stop or at least state or federal overreach with inappropriate mask or other mandates. Let me support my endorsement by providing a little personal and factual background. I spent over 40 years of my adult life in the medical business. My wife's an RN, my daughter is an RN, my son-in-law is a PA, and my mother was an obstetrician when most women were not doctors way back when. I served 25 years as a now retired Medical Service Corps officer, plus 14 years as a defense contractor leading organizations where we tried to teach indigenous soldiers overseas combat medical skills in Afghanistan and Saudi Arabia. I also have a personal understanding of pandemics and epidemics. Spent 3 years at U.S. Forces Command as a principal staff officer overseeing Army HIV screening and development of Army HIV policies. I worked with then Colonel Robert Redfield, the CDC, the NIH to develop vaccine screening and implementation policies and processes. The Army spearheaded these processes and antivirus programs and have a very long history in vaccine development. Scientific evidence shows a couple of incontrovertible facts now. Masks have a limited impact on the transmission of viruses. They're simply too small. They get around the masks. Doctors use masks continuously in neurosurgeries because it's to keep the doctor from infecting the patient, not the patient infecting the doctor. Also, COVID vaccines we know now full well, do and did not prevent COVID, do and did not stop transmission of COVID. The vaccines probably caused hundreds of thousands of negative VERS incidents worldwide, which supports both Ed Doubt and Steve Kirsch's position the vaccines caused widespread comorbidities and numbers of deaths. My father worked for Searle Laboratories for over 30 years. At that time, it took 7 full years to get any drug to market. We had to go through phase 1, 2, and 3 trials. Any more than 80 adverse VERS incidents would have caused them to pull the drug from testing and from the market. We approved a drug and an immunization, if you want to call it that, or a vaccine, within 18. We cut it short. We're paying the price for doing so, unfortunately. Eisenhower warned us about the probable overreach of the military-industrial complex. We have now entered the period of the pharmaceutical industrial complex, which has had negative major effects on our population. As Donna commented, we had over 25,000 small businesses within Colorado never came back once they closed. So it's imperative, and I'm asking you that it's essential you take the opportunity to be strong advocates in El Paso County for our constituents by passing this resolution, supporting our constitutional, personal, and God-given rights. Thank you. I appreciate your time.
Comments?
Comments or questions? Certainly.
General Briggs.
Actually, it's not a question, it's just a comment. So in the previous pandemic, I had the fortunate opportunity to compare responses of 2 different states. So I was living in New York City, and we had a particular response there when we moved during the pandemic back to Colorado Springs. What I would like to say is I would encourage all of us to realize that this board and this staff approached it much differently than what I experienced in another state, in another city. There was a lot more logic here. There was a lot more thought, I thought, about what the impacts were going to be. And I saw a disparate and much more positive outcome here in El Paso County than I did in my previous experience. So while this is challenging, this is hard, not an easy thing, I want to maybe instill a little bit of confidence in you that this board and this staff are working hard at not just a pandemic, but all public health issues to do the right thing for the community while respecting individual rights, the proper role of government, active citizenship. Those are the things that are being discussed as we do those things. And so I would encourage all of us that we're in a better spot than other places. Thank you.
I would fully agree, and thank you. Thank you all for all of your hard work that goes into trying to develop public health policy.
Thank you.
Thank you.
Okay, because I boo-booed last time. Is there anyone else that I missed on public comment? Okay. Thank you both. Yes.
Mr.
sorry.
Chair, I think this was a wonderful public comment session, but I wanted to see if we could get a refresher really for the public and for ourselves on the board rules of are we limiting time? I just want to be clear and consistent with each public comment session for each meeting, and I'd love to be reminded of whether this board has established time limits or other ways to communicate during the formal public input sessions.
Yes, we do. We have, public comments are limited to 3 minutes, and they were informed prior to presenting that they had 3 minutes. And the gentleman went seconds over, but he was closing his comments, so I allowed it.
Great, thank you.
Okay, and now it is time for our finance and budget report.
Good morning, Samantha Samantha Montmany, Budget Supervisor with Health and Human Services with El Paso County. So today we're reviewing the August report. Some items to kind of highlight. I did want to point out again the ELC grant. That is again a very COVID-specific, very time-limited grant. That grant did end at the end of July. So we're unable to continue to draw down anything from that. Overall, though, we are seeing our revenue slightly below what we anticipated, but again, our expenditures are also behind what we're anticipating at this time. A lot of our grants are 100% reimbursable, so again, if we don't have the expenditures, we're not able to draw down those revenues for them to offset. So overall, though, we are looking in a good state. Budget doesn't have any concerns. You guys have any questions for me?
Questions from the board? Nope, seeing none. Thank you.
Yeah.
As long as you're giving us the thumbs up, I think we're. Okay, and now we've got a number of new contracts. I think that talked about this, that got some presentations from staff, and it looks like several of these. So I think we're going to move through them as quickly as we can. First one, impaired driving prevention. Okay.
Good morning, Hudson, the Health Promotion Division Director. I'm here to present the impaired driving prevention new contract. This funding was made possible because of the Communities That Care Teen Action Board. The Teen Action Board had been working on an impaired driving prevention campaign, and their efforts were recognized by the State Health Department. So CDPHE, the Colorado Department of Public Health, invited us to, or offered us this funding without even having to apply. They wanted to support the Teen Action Board's prevention campaign and complement other existing prevention efforts here in El Paso County. So this funding will not only support CTC's Teen Action Board, but it will fund half of the Injury and Violence Prevention Planner, who will oversee the Child Fatality Review Team. According to Sept data, motor vehicle accidents are among the highest cause of death among youth in El Paso County, so that will give this person an opportunity to really look at those trends and implement prevention efforts in our community to help address motor vehicle accidents as well. We also intend to collaborate with existing partners and coalitions in the community, such as the Sheriff's Office, Pikes Peak DUI Task Force, Drive Smart Colorado, and Safe Kids Colorado, excuse me. This is a 5-year grant that's provided by the Colorado Department of Public Health and Environment, and we will receive $100,000 each year of the 5 years. This contract allows for full and direct, and the contract dates for the first year are October 1 of 2023 through June 30, 2024. The subsequent years will follow a typical state fiscal year of July 1 through June 30. As I mentioned, the funding is going to support half of the Injury and Violence Prevention Planner position and 10% of an Executive Administrative Specialist. If we could go to the next slide, please. The first year of this funding requires our agency to complete a needs assessment, which we will do in collaboration with our community partners, complete a 5-year evaluation plan, and then we had to choose a foundational strategy and 2 supplemental strategies. Our foundational strategy, as I mentioned, is to work with the Teen Action Board that's already in existence and with Communities That Care to support their social norming campaign around attitudes towards driving while impaired and excessive use. Our supplemental strategies will be to disseminate information, which we will do in collaboration with our community partners, and community-based processes, again, with our community partners that I mentioned. Are there any questions about this new contract?
Questions from the board?
Yes.
Of the region that this impaired driving will affect?
Yes, absolutely. So this grant will support the Teen Action Board social norming campaign that is focused in Fountain Valley, but it will have a broader scope. It is the funding is meant to support all of El Paso County. So that's why we will be working with our community partners, not only in Fountain, but throughout the county. And then obviously the Child Fatality Review Team, which will be the other portion of the Injury and Violence Prevention Planner's role, is really looking at all youth deaths and addressing those trends and implementing prevention efforts in the community to protect all of El Paso County.
Not sure if I heard you right. You say something about full indirect.
Yeah, so some of our grants are will allow full indirect, which is the 23.06%, and some only allow like 10%, for example.
Councilman Donaldson.
If I could, yeah, thank you, Mr. President. Social norming campaign, just a
Sorry.
phrase I don't believe I've ever heard before. Could you explain what that is?
Absolutely. So the Teen Action Board is working on a campaign to make impaired driving or not driving while impaired the norm. So sharing positive messages about what youth are doing, what teens are doing in the community instead of impaired driving. So making it the norm that you would drive not impaired or with a safe driver that is not using any kind of substances.
And then how would they share those messages? What's the ways they're going to do that?
Great question. That's something that we're going to develop. I know the Teen Action Board would like to develop videos that will be shared through social media. I mean, obviously, if we're trying to reach youth in our community, we want to use outlets that they're looking at. So social media, I would imagine, would be our main focus. But with this funding, we are hoping to work with a group to come in and provide training, advocacy training to the youth and help them develop this campaign so that it has the best reach possible.
Colonel Briggs. Oh, go ahead, Dory.
Is the funding adequate? Daisha, thank you for the presentation, by the way. Is the funding adequate? Is it enough?
It is. It complements work that's already being done with CTC. So we have funding within CTC and our Colorado Trust funding. So this is going to complement, which is why we were able and felt it made sense to fund half of the Injury and Violence Prevention Planner so that we can have a broader scope for the county. Yeah.
I'd like to add to that. Part of our local public health model is to enhance already ongoing efforts. So one of the areas that was important to us when we accepted the money was that we are going to enhance efforts that are already going on with law enforcement. Colorado Springs Fire Department, Police Department, as well as the Sheriff's Office, because there are already good efforts that are going on, and how can public health strengthen some of those and working specifically.
Colonel Briggs.
Yes, General Briggs. I would also offer maybe it's a good idea to look at some of the smoking cessation and suicide prevention programs that have already been used with youth. They seem to have some traction. So instead of reinventing the wheel about how to do this, to add on to those things which are social norming.
Absolutely. Thank you for that.
Dr. Chan.
I guess I just want to clarify because in my mind, I'm assuming that impaired driving extends to not just DUI, but other substances and distracted driving,
Yes.
texting other people in the car, distracting the driver, et cetera. Is that correct?
That is correct. You're right on track. And actually, the Teen Action Board really had an emphasis on marijuana use while driving because that's what that community or that group is focused on. But you're absolutely right. It's distracted driving, not just alcohol, but marijuana. So really addressing all of those things so that, kids are educated and aware of the risks associated with that.
Thank you, Mr. President. And so I kind of also was on the line of Councilman Donaldson in terms of it looks a little vague some of the details were, I wasn't exactly sure what that meant, but this is very clear. The first year will be highlighting and identifying the details of how to implement this process forward. So I'm comfortable with it. First year will be vague because that's what the first year program will by how best to get.
Thank you. And we are required, as I mentioned, to have an evaluation plan that will span the course of the 5 years of funding, and we are required to work with CDPHE on that. And so we will have a good plan moving forward to ensure that we're having an impact.
One final comment. On that same note, I think it's exceptional that something that can be developed into a fully executable plan was developed by a teen action council. I am incredibly impressed with that. And I look forward to seeing it. I look forward to seeing those kids activate amongst their peers in actually executing something that could have just been a good idea on, during a break at school. But because of the support of this community, this board, some other structures that we've put in place, we're actually able to help that come to fruition to help our larger community.
Population in the state of Colorado, as you see here, the number listed. We do have 1.9 FTE staff dedicated to this population. The maternal child health received 130 referrals as of October 1st of 22 through August 28th of 23. This is linking individuals to resources and services within the community. Staff help reduce barriers to accessing services by connecting their families to the care that they need. This is also evaluating preventative approaches and engaging community through a work group. In addition, this program focuses on improving pro-social connections. So some of those activities include training a total of 963 individuals in the last year on social-emotional well-being topics. This included 5 school districts, so District 11, 14, 3, 49, as well as 54 JT. This also included 6 youth-serving community agencies, so BOCES, Colorado College, Fountain Forest Carson, Schriever Air Force Base, Catamount Institute, community centers, as well as our own internal programs. In addition, the Maternal Child Health has a memorandum of understanding in place with D11. This is going into our 4th year. This is a partnership to educate staff, families, and community members on the neurosequential model in education, otherwise known as NME. They provide approximately 11 to 12 professional development in the NME concepts. Since the inception of the MOU, there has been 390 individuals trained. And finally, I do want to highlight an additional partnership that has been formed with D14. Our MCH staff member, Paula Herger, has been a thought partner with D14, providing numerous trainings to help the initiative to have all district employees trained in NME. She provided a book study that gave an intro to NME concepts that then gave the district a strategic setting to develop a bigger plan within the district. This resulted in D14 initiating their first unified improvement plan goal, stating that all staff would be trained in trauma-informed and responsive practices, utilizing the NME philosophy and concepts. I want to highlight some numbers. In 22, there were 31 participants that were trained through a book study as well as classes. And in the last year, we've already had 48 participants. Last slide. I really just want to end with the goal of Title V Maternal Child Health Service Block Grant is to develop, implement, and evaluate evidence-based maternal and child health action plans that promote and contribute to healthy outcomes for Colorado women, children, and youth. And I'm happy to answer any questions.
General Briggs.
I have a question that maybe for the board and for yourself. So if there's a young parent who has their child go to school and the school says there may be something up here, can somebody walk me through that? I mean, how's that happen? What goes on next where that child then gets connected, when that family gets connected with services like this? Or do providers do that? Or does the teacher do that? Or the counselor at school do that?
So I
How does
can,
that happen?
yeah, I can, is this on? Okay. I can answer that from our program's perspective. So we do a lot of outreach to school districts as well as school counselors, school social workers to really let them know about our program. And ultimately, the goal is to assure those families are aware how to link with us. And we can walk those families through the ins and outs of navigating, getting those services in place. Oftentimes, it is referring to your primary care physician, but sometimes it's just helping the family walk through it and having a partner there with them and just making sure that they get the services needed.
Quick follow-up. Okay. So maybe we're driving down to my real question here is, does any of this ever happen outside of the notification of parents?
Typically, they would refer to the parents who would then reach out to us, or school counselors can connect with us and we can provide them information as well. But it's really a partnership with families that we would like to see.
So the parents are involved.
Yes,
Okay.
absolutely.
Thank you.
Since I'm new on the board, I don't know how long this program has been going on.
Oh, goodness. It is a long-standing grant that we have had with El Paso County Public Health. I might look into the crowd to see, but I want to say going on plus 20 years. I mean, this has been a very long-standing grant.
Follow-up question. So the information that you presented is primarily output data, right? The number of people who are trained is output. And I see that you do have an outcome or an impact goal of contributing to healthy outcomes for women, children, and youth. Is there a measurement and evaluation plan that measures outcome?
That is a great question. So through CDPHE, we do have to follow certain logic models and action plans and report back to CDPHE on our activities. And we do have certain measurements and goals that we do have to achieve in it, whether that's providing a sufficient amount of training, doing activities where we're trying to reach individuals on a larger impact or scale. And so we do have to report back to them. We also look at qualitative and quantitative data, so gauging information from the community around what they need and involving them within our program as well. Did that answer your question?
Partially.
Okay.
So I think what I'm trying to ask is, obviously, in a short-term contract, you're going to see output first. But for something that has been going on for, say, a generation, is there any information on the impact or the outcome for your goal for healthy outcomes?
Absolutely. And so something that we're going to be trying to implement this year is doing post surveys for each of our training to gauge what that impact looks like. So we really want to know, if we provide you this training, what will you then do with that information and how will it then impact the youth that they're serving? And so I do hope to have a little bit more of that data this following year once we implement those post surveys. And that's something I can also follow up with you on more if you have additional questions.
Right, thank you.
Thank you, Mr. President. So my question relates to sort of statistics showing that we have the most children with special health care. We're the largest county, so to me, that doesn't necessarily show something really terrible. We're the largest county. I would also probably have births. But when I see that, what's an example of a special health care? I know one of the things we looked at that I was told we are above average, like low birth rate for our children locally. What's an example of that? Is that something that we're trending, watching several years for improvement?
No, that is a fantastic question. So the formal definition for children and youth with special health care needs is a child is birth to 21 years old who have or at increased risk of a physical, developmental, behavioral, or emotional condition. So it is quite broad. It could be a child all the way from having asthma to those more complex conditions like cerebral palsy. So it does have quite a bit of range. And we are able to pull out pieces of that data as far as what are the highest diagnoses that we see. Commonly, you see more of those behavioral like ADHD, but that is definitely something that we will continue to track. I think the next largest county is like 38,000, so it is quite a bit of a gap that we do have the majority, but it is a broad definition.
Thank you. And then as it goes back to doctor's previous question was, you have this, how many, some of this asthma, whatever, that's the kind of, are we improving,
Yeah.
staying flat, or?
That's a fantastic idea, and that's something that we can look at implementing in our program to make sure we're tracking that as well.
Dr. Booth?
I guess trying to close the gap in regard to the questions that were asked. What are some of the outcome metrics that have been last 20 years?
So I would say it has changed over the years in how we implement our programs work. So I wouldn't be able to give you an exact answer because it has changed over the years. We have to adapt with our community based on the needs. And so our program services have adapted with that.
Thank you. What are some current outcome metrics that is measured?
So we are looking at how many individuals that
Or is it done directly with counselors and the school board, essentially, may or may not hear about it?
So this, any training that's offered in these districts is in collaboration with their administration. I do have some numbers as far as administration being a part of these trainings as well. And so usually it's the superintendent that is aware of it and offers it for these schools. So yes, they are informed and it's available for them as well.
Okay, but it's a little different than the school boards getting a briefing about it. And so maybe that, I'll save those questions for the future, but that's something that interests me. Are the school boards aware of what is being occurring at the schools with this, which the title maternal child health program, to me, it just implies, hey, this is medically focused, low birth weight children, primarily medical things. And I know, emotion or psychology is part of medicine, but maybe a big portion of this really is in that field. Is that correct? I mean, is that where 70% of the dollars go, is more towards social, emotional well-being, trauma related, whatever the last thing was,
So
you say?
So a part of the requirement of our grant is over 50% has to be dedicated to making sure we are serving children and youth with special health care needs. But again, that's so broad. It could be developmental, behavioral, mental health. So it can be broad, but we do have to make sure that we're focusing on that area.
And this would just be my last thing, just a definition. Trauma responsive practices, they were trained in trauma responsive practices. What does that mean?
So there are a couple of trainings that are provided by our MCH staff. Specifically, there's a trauma responsive training called the neurosequential model in education. So this draws upon the NMT, informed biological perspective on human development and functioning. So this is to help educators understand student behaviors and performances as it relates to trauma responsiveness.
And what is trauma responsive? What does that mean?
Essentially, it is providing the educators or any youth serving organization how to be aware of the signs if a child is exhibiting any type of trauma response and some techniques or protective factors to put in place to support the youth.
Thank you.
I did want to note that we have a close partnership with Department of Human Services as well. And I do want to assure you that anything that we are doing, we work with superintendents. And since the superintendents report to the school boards, we do rely on them heavily. We have over 17 different school districts in our county. And so it's the schools that superintendents and their administration and their leadership that are interested. And we are relying on them to cover the bases and work with their boards as well. And we're happy to present at the request, but I do want to emphasize that just like if we're working with some type of partner, I'll have the responsibility of sharing that information and making sure that our board is okay with that. But this is a program that has longstanding. It does have a lot of value, is making a lot of progress, and I'll take back all of the themes and the questions and provide a presentation that's more data heavy, is what I'm hearing.
Okay, thank you. I appreciate the questions from the board. We do have a number of these, and then we've got a really big presentation coming up. So I want to ask us to be as streamlined as we can with our questioning. We do need a motion and second to approve this ongoing grant.
I'll move approval.
Okay, thank you, Cammie.
I'll second.
And Commissioner Gonzalez was second. All in favor of approving this ongoing grant, let it be known by saying aye.
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 Any opposed? Okay, thank you very much.
Thank you so much.
Okay, women's, infants, and children.
Morning, having me. My name is Melissa Gordon. I'm the program manager for the Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC. Slide. So we have the contract dates of the federal fiscal year, October 1 through September 30th. The contract amount this year is over $3.4 million with a state negotiated rate of the 23.6 indirect. These funds go to supporting the pregnant women, infants, and children up to age 5 through nutrition education, breastfeeding support, community referrals, and of course the supplemental food benefits. The nutrition education is tailored to each family depending on what they discuss with their paraprofessional educator during the appointment. And the breastfeeding support also does include a pretty robust breast pump loan program. We have about 40 staff members, which include registered dietitians, paraprofessional staff, and a number of staff that also have advanced lactation credentials as well to support. Go to the next. Okay, so last year we served over 20,000 unduplicated participants, so unique individuals, and this does include infants, children, pregnant, and postpartum women. And this year we are looking at above 18,000 year to date. Last year's annual monthly average enrollment, because we do hope that participants are, obviously staying on the program for longer than just 1 year, was 12,707. We have seen pretty consistent growth this year, with currently our average monthly enrollment at 13,184. We're really proud of our mobile clinic efforts that we started last year and really resumed at around March of this year. And the goal of that project is really just to decrease barriers for a variety of different reasons in our community, barriers to enrollment in WIC. So we are co-located at about 6 different partner sites, which include Fort Carson for our military families. We're up at the north portion of the county for our caregivers with babies in the NICU, at Ronald McDonald House, Lutheran Family Services for our refugee clients, and then we are also out east, Calhan Community Outreach Center. So again, we're really happy with the progress of this project. Thus far, we've been able to do over 90 appointments out in the community rather than having the clients come to us, which is great. While the focus of WIC is nutrition security and food security, we also are in a unique position where we do frequently touch base with our pregnant and postpartum women clients. And so with that, we do perinatal depression screenings, over 4,000 year to date this year, which is really wonderful. There's also, of course, the economic impact of WIC, so those food benefits that are spent within the county, and last year it was over $8 million. And then really, I just always like to convey kind of the true impact of the program, which is the participants. And, the food security aspect is important, but then also the benefits that they are seeing with the program. So next slide just has a couple different quotes from our families about, how they are feeling about the appointments and about the services that we are providing. With that, does anyone have any
Question? Dr.
So, we know that obesity is a tremendous burden on public health costs. And I think we all know that a key time to intervene is during a pregnancy when a woman is very concerned about her overall health and the health of her baby. So does this program also include obesity screening and nutritional counseling?
It does, yes. So we have a number of risk factors essentially. So when a client has an education appointment, their paraprofessional indicator or educator will essentially like flag different things. High maternal weight gain is one of those things, as is low maternal weight gain. And then that client will have an appointment with a registered dietitian at that time. So yes, it does address that. And then same thing with our childhood obesity. When clients are coming into the clinic, we also take height, weight, and hemoglobin. So we are able to address some of those anthropometric concerns with regards to weight and also iron levels.
Questions? Okay, entertain a motion to accept this ongoing grant.
I will make a motion to approve, and I also want to call attention to the fact that we're in the last 3 days of Hunger Month, and so just wanted to say this program goes a long way for helping those disproportionately perhaps affected by food insecurity. I move approval.
Thank you, Commissioner Bremer. Do I have a second?
Second.
Commissioner Gonzalez, second. All in favor of accepting this grant, let it be known by saying aye.
Aye.
Aye. Any opposed? Thank you. Passes. Okay.
I did want to add that Melissa doing a great job of keeping informed about the possibility, what will happen to our WIC program if there is a federal government shutdown. And what will happen is we'll not be able to provide any of our clients vouchers to get food October 1st. And the state health department, we're working with them, and they have committed to providing 4 weeks of operating to maintain our staff. But this is kind of a wait and see. I'm not really sure which way it's going to go, but with the 13,500 clients that we serve, we will definitely be impacted. We'll keep you posted, but did want to provide that note.
Okay. I think we already voted, didn't we? Thank you very
Thank
much
you.
for your
I actually have the
presentation.
next one as well.
Okay. I
Yeah.
saw another WIC on here,
Yes.
so.
Yeah. So this